right amount of medicine a doctor gives you to heal. But here at Medical Dose, we're not treating illness or patients. We are talking to doctors to bring you something just as important: your weekly dose of medical knowledge. Clear, simple, reliable, and more importantly, made for you. I'm Sandy Mustafa, and I'm going to be your host. So welcome to Medical Dose. Today's dose is all about something that almost every one of us is actually really guilty of: staring at screens all day long. I don't have a screen today. From smartphones to laptops to tablets, our eyes are doing over time, and it turns out they're not exactly loving it. So we're asking today, is your screen time silently damaging your vision? To answer this and more, I'm joined by someone who has literally seen it all. Dr. Sandip Mitra, consultant ophthalmologist and the head of department at Alzahra Hospital, with decades of experience helping people see the world more clearly. Welcome, Dr. Mitra, and thank you for joining us at Medical Dose.
Thank you very much for inviting me to this talk.
All right, let's dive right in, doctor. You probably get this question a lot. Is screen time actually really bad for your eyes, or is it just a myth?
You are absolutely right. It's not a myth. Screen time does affect your eye in various ways. We call it computer vision syndrome or digital screen syndrome. Now, what actually happens is that whenever you are watching a digital screen, it does produce some amount of fatigue to your eyes. Mm-hmm. That's the most important thing. But there are other multiple effects of it, okay? So it also depends on how much of time you're putting on the screen, mm-hmm. how much of light that is coming out of the screen, the contrast, what is there. So there are multiple effects which you can see with the digital screen.
Mm-hmm. And you've probably seen a rise in let's say, the digital eye complaints over the past few years, let's say in the last 10 or 15 years. What are the most common complaints?
So not only, the adults that we use screens, even children nowadays, they work on digital screen a lot. So the main complaint is that the patient has fatigue at the end of the day. They have very severe dry eyes. The patients, actually children, they come with complaints of frequent blinking of eyes. They have a lot of headaches at the end of the day. Some children also and adults complain of disturbed sleep during night because of use of screen. So there are many, many complaints for which the patient comes and sees us in our clinic.
So it's mainly related to eyes fatigue, let's say, and dryness.
Yes, eye fatigue and dryness. The reason of dryness is very important, especially when you stay in Dubai and in this sort of atmosphere.
Okay.
Because not only that, you forget to blink when you look at the screen. So you blink, let's say every second you're blinking once, and it helps to wet the tear film, which is the most important part of the vision, because the light enters through the various layers. The first layer is the tear film. So if the tear is not perfect and you're not blinking enough, that means you actually don't see well. So you are forcing yourself to get the images clear, So it's like, you're not looking straight.
So you're putting extra effort on your eyes.
Yes.
Speaking of which, speaking of light specifically, what's the deal with blue light? We've been hearing a lot about it lately. Yeah. Is it really as harmful as people say?
True. I mean, there is no clear clarification how blue light works, but there is blue light is a low wavelength light between 460 to 490 nanometers, but it has a lot of energy. So the blue light actually, when it hits the eye, the chances of fatigue is higher. So that's why nowadays we recommend a lot of people to use blue light filtered glasses, or they are called smart vision glasses.
Okay.
So they do help. They reduce the blue light. It reduces fatigue. So if you see many of these big computer giants, for example, Google, Yahoo, or Microsoft, they actually have these glasses
for
at the
their
entrance.
Employees.
Yeah. So you pick up the glass and you go for work.
But do they really help, or are they just like a social media trend?
No.
No.
They do help.
All right.
Help. But then there are different types of glasses in the market. Okay. So there are blue lens glasses, which filters the blue light. There are anti-glare glasses. So if you're working like in a studio where you have a lot of lights, so you have reflection from the screen, that also causes fatigue. So you can then have an anti-glare.
Anti-glare.
So it depends where you're working, So your work environment defines the type of glass you need to use. Also, there are cooling glasses. So, the screen does emit some amount of radiation and it causes heat. So you have these glasses which have cooling effect. So actually, not only it prevents the extra energy which is coming out of the screen, it
Sorry,
does...
doctor, cooling glasses?
Yes.
We've
It does
never-
have a cooling effect. So if you are watching through, like, for example, the glass I am wearing, it has got an anti-glare, it has got a blue light filter, and it does have a cooling effect. So it depends on the material in which the glasses are made. There's a company called Zeiss, which actually makes these cooling glasses.
I see.
So if you use them in a office setup, it does help your eye. It just has a cooling effect.
But can we get access to that easily in the market?
Oh, yes.
It is available
They
in
are
the
very
market.
much available here in Dubai and UAE. I'm sure it's available online as well. But then, you need to buy it from a proper vendor to get the proper glasses.
Of course. Trustworthy place.
Trustworthy.
But let's be honest, doctor, like nobody's giving up their phone anytime soon. It's going to stick around for so many years, obviously. So what can we actually do to reduce the harm?
So there is a very nice way to do that. One is called 20-20-20. So every 20 minutes of your work, you should give a 20-second of break. So what you do in that break period, you look 20 feet away. So you actually focus an object which is far away from your screen, and then you blink your eyes for 10 to 20 times. Doing this, I'm not saying that you follow this strict order, but at least half an hour to 1 hour, if you give a tiny break, look out far away, do some blinking exercise, you will be better off. Your eyes fatigue will be much less, you'll be much better off. And then, sometimes we tell patients, okay, look, if you are not going to do that, use artificial tears, Just putting those tear drops to supplement your natural tears is actually going to work. Or you can keep a humidifier at your office. So you have AC running and then you have a small humidifier where you are working. It really helps. Again, it wets the eye. You feel more comfortable. So these are the things which you can do. And also, if you get breaks, for example, it also works well for your spine. So you're not always crouching, you don't get cervical spondylosis, for example. So there are multiple effects which you can do to breaking your work in between.
I want to shift the focus really quickly to shed some light on children. Our kids are digital natives. This generation is born into a world where everything, literally everything, school, entertainment, social life is dependent on digital media and is connected to screens. So while we adults might remember life before screens, they actually don't. So with that in mind, and let me talk about this study very quickly. A recent study published by The Guardian found something quite alarming. For every additional hour children spend on screens each day, their risk of developing myopia or nearsightedness increases significantly.
You're right. Actually, if you see the population, in the Asian population, many of the children, for example, in Japan or China, for example, there have been a lot of studies. What you are mentioning is true. So we encourage children, not only that they spend time on their work, on their digital, but they also should go out and play. Or wherever the natural daylight is available, you make their desk available towards the daylight. So you lift the screen up, and in schools, it's better advised to have big windows so that the daylight is coming. So the wavelength of light, the daylight, the violet light is very good
From
for
your
children.
experience, doctor, have you seen more cases in kids of nearsightedness?
Yes.
Really? At a very young age?
Yes. Actually, many of the parents, they say, look, I don't wear glasses. My wife doesn't wear glasses.
But my kids do.
grandparents don't wear glasses. Why my children are wearing glasses? And then we tell them, look, there are two things. One is the nutrition, what they're eating. Number two, how much time they're using on digital.
On digital.
Yeah. So these are the two things. Also nutrition, I think they are very important. The children should have proper diet. That really works.
All right.
So good light, good vitamin, it will work.
Perfect. Dr. Sandip Mitra, could you leave us with just one dose of protection for our eyes, whether be it for kids or adults? What would that be?
I think today's world that we are in, we are basically an indoor object. We stay indoor more than outdoor. If we have time for our children and for ourselves to spend little more time outdoor and get the natural light into our eyes, it really helps. So I'm not saying stop doing digital work. I'm saying practice healthy way of doing.
Yeah.
For example, doing eye exercises, as I said, using protective glasses, but also look at your lifestyle. Try to reduce.
Just go outdoors.
Yes.
Thank you so much, Dr. Sandip Mitra, for joining us and for this eye-opening conversation. And to everyone listening, take this as your reminder to actually blink, take a break, and maybe just put the phones a little bit down. Maybe your eyes will thank you later. Thank you so much. This has been our medical dose for today. Stay healthy.
Thank you very much.